When I came, we're actually using one room for all things that pertains to the facility. Most of the people we serve felt very uncomfortable coming to that single room to do all things. Before we met St. Ghana, we had no electricity in the facility. We had no water. Most of our deliveries comes at night, and when it comes and there's no light, it becomes very difficult. If there are some tears, some minor tears, you may not be able to see it with ordinary light, torch lights. And if you want to wash hands and you don't have any major water supply, then you are going to have it very difficult to do proper hand washing at the end of every procedure and before every procedure. Yet we had to endure because we wanted to serve humanity. Now we have a full compound. After the dialogue, after the sensitization meetings with the St. Ghana, they pushed so hard at assembly to get this structure, the expansion, the electricity, as well as the water. Once we are on the electricity grid, it helps us so much. Now the first thing we always do is washing of hands. Now we have one strong motorbike which is helping us so much in what we do, because most of the communities are far apart, and without motorbike it will be very difficult. It means that we wouldn't be able to do effective home visits. We can't visit the people who are sick. We can't help the people who really need our help. Despite what we have achieved so far, there are still challenges that we face. Our referral systems are not very good. Recently, a child was born premature. We had to quickly refer the child to the main hospital. We had no proper means of transport, so we had to use the motor. And with our roads going up and down, shaking here and there, along the way, before we go to hospital, we lost that baby. We think that if there is a car or even a proper referral transport, it will help us serve the people better. It will enhance our work so much, so that we together we can build a better health system in our area here.